Everyone, we are back for part 3 of our communication lectures. Today, we are going to be talking about terminology that is important in the massage office. And as with every other lecture in this class, if I reference a textbook, it's going to be the Mosby's Fundamentals, your 8th edition. All right, now we have talked about how important communication is to clients, but you also will be consulting with other healthcare workers if your client comes in on a referral, if they have a diagnosis you need some more information about before feeling completely safe working on a client's condition. Please note that you need to listen and take notes. Now, we talked about listening in a lot of detail in the other lecture. This lecture, we're going to be covering using proper terminology, professional terminology, when you are doing these consults, written soap notes, talking to your clients, whatever it may be. Our communication is going to remain professional, and we are going to use commonly accepted terms so that everybody understands the definition of the illness or issue that you are describing. All right, everyone, like I have mentioned in some of the other lectures, you need to be culturally competent, all right? Culture is often described as the combination of a body of knowledge, a body of beliefs, and a body of behavior. Massage therapy is provided within a global community, and this means we interact with others that are from other cultures. They have different beliefs, different behaviors, and different bodies of knowledge. Even with massage therapy itself, we are taking what was a staple of Eastern medicine and their body of knowledge, and we are now looking at it through the fairly modern lens of Western medicine in order to get licensed to practice massage therapy in the United States. Even within massage licensure, the difference between countries varies greatly. All right. Cultural competency requires that you explore your own culture and have a sincere curiosity about other cultures to develop the ability to interact genuinely and respectfully with others. All right, now you may be thinking, I've maybe never traveled far out of Michigan or out of the United States. Like, I haven't seen that many cultures. Michigan itself is very diverse. My absolutely favorite nephrologist is from East India, the gentleman that helped when my husband was having a lot of issues with his nervous system. We thought he had a stroke. We saw probably 7 different neurologists. My absolute favorite was from West Ghana. Absolutely vast body of knowledge, probably the best doctor we had seen the entire year. And I refer everybody that I possibly can to her is Antanuki Akinpoye. She is absolutely the best OBGYN. She's also the program director over at Hurley for the department and is a faculty member. Absolutely recommend everyone I meet to go see her if they're ever in the market for an OBGYN. She's from Nigeria. All right. So not everybody is going to be born, raised, and only having the culture of Midwestern people from Michigan, even here in your practice for massage therapy or for other healthcare practitioners that you're going to work with. Please remember that you are going to be working with people who speak other languages, people who have different religions, and people who have different sets of beliefs. This also comes with different definitions of words. As we have different cultures, we have different connotations and meanings behind words that we learn. Okay, I'm not going to dive into the semantics of it right now, but as we discuss terminology later in this lecture, please remember that if you are talking to a client who may not understand medical terminology, you will need to define it to make sure that you are on the same page. All right, everybody, we also need to make sure that we are using as much gender neutral and age appropriate terms as possible. Now, we have talked about gender terms before. If people have different preferences for pronouns based on their gender, and of course, they could use no gender. The Ojibwe or Anishinaabe use like Nish Manadoag to mean two spirit, is what we call it in English. But Often there is a preference in the medical community to sort of shy away from notating gender in particular at all. So we might want to use gender neutral language or gender inclusive language that avoids a bias towards a particular sex or social gender. All right, we can use humankind, people, partner, spouse, right? We don't have to say wife or husband. We can just say partner or spouse. That could mean either or. Significant other, parent, sibling, child. These don't donate any type of sex at all. They just allow us to notate that person's role in their life. The most common gender neutral pronouns, of course, are they, them, and theirs, and they're acceptable whether you're speaking about an individual or a group of people. If you're unsure, just revert to neutral, and that will keep you safe generally, unless someone gets offended by it. All right, use respectful language for those over the age of 65. The term older adults currently is considered politically correct. Seniors and elders are tolerable depending if they accept it or not, but elderly is not recommended because it usually implies that the older person is frail and in poor health. All right. What if you don't believe that there is any neutrality in gender and you want to make sure you call everyone him or her, no matter how your client feels about it? Well, it's a little bit rude to other people, but in addition to that, it could be against the law. All right. House Bill 4474 here in Michigan is expanding what constitutes as a hate crime in Michigan. All right. The bill defines gender identity or expression as having being perceived as having a gender related self identity or expression, whether or not associated with an individual's assigned sex at birth. And a lot of critics are claiming that since that House bill lists intimidation under the list of prohibited acts, someone could potentially be charged with a felony for using the wrong gender pronouns. All right, you're getting licensed in the state of Michigan. Let's make sure that we are following federal and state laws. This top quote I had pulled quite some time ago from the NIH. Underneath this current administration, most of the NIH pages are unfortunately not able to be accessed at this time, but it did say that intentional refusal to use someone's correct pronouns is equivalent to harassment and a violation of one's civil rights. Okay, so you may have a personal belief that you do not want to follow this. Currently, the law does not agree with that belief, and you will need to remain professional and respectful of everyone's personal rights, okay? Using the incorrect pronouns at this time is equivalent to harassment and a violation of one's civil rights. All right, the Americans with Disabilities Act, the ADA, defines disability as a physical or mental impairment that substantially limits one or more major life activities. And although the term disability itself implies a negative, it is currently the most objective term that we have in English. So please be aware of that. Now, just to state in this particular lecture, I'm going to be talking about what the ADA defines as disability terms. I will not be talking about other things that we need to pay attention to underneath ADA as massage therapists, such as the need for having a handicap ramp. If you have stairs going into an entrance, you also need to have wheelchair accessibility. You need to have accessible bathrooms, etc., etc. There are many other things underneath the ADA that you need to be compliant with as a massage therapist. But for the purpose of today, we are only focusing on the terminology. All right. So, disabilities may refer to a physical, sensory, or mental condition. The thing that you need to remember to stay professional and maintain a safe environment for your clients is to always use people first language. People first language literally puts the person first in focus of your terminology instead of the disability itself. All right. Non-disabled is the preferred term when the context calls for a comparison between people with and without disabilities. Used non-disabled or people without disabilities. All right. Do not use the terms as able-bodied, normal, or whole. Okay, we don't describe anyone as normal. We have hidden disabilities. A lot of us have sensory, perhaps mental conditions, physical conditions that are not visible to the naked eye and cannot be discerned within a few moments of meeting someone. All right. We do not use the term handicapped because many people with disabilities consider it offensive. Some people prefer identity language to people first language as a way to signal their disability pride. All right. Person might proudly say, I am autistic, but still that guiding principle remains. Give people with disabilities the dignity and respect that all people want by utilizing people first language in the massage office. All right, we're going to follow these guidelines for respectful communication. We are going to put the person first. Yes, not the disability. Okay. We're going to emphasize abilities, not limitation. For example, you're going to say uses a wheelchair rather than confined to a wheelchair. Do not focus on the disability at all unless it's essential to services that are being provided. All right. Avoid condescending terms such as special, handy-capable, differently abled, and challenged. Although special is used in the names of some education programs, it's offensive to many adults with disabilities. All right. A disability is not an illness. People with disabilities can also lead healthy, normal lives. All right. So we're not going to have it as the leading focus unless it significantly interferes with the services being provided. All right, according to WHO, the World Health Organization, disability has three dimensions. All right, that's impairment in a person's body structure or function or mental functioning. All right, that could be losing an arm, loss of vision, memory loss, activity limitations such as difficulty seeing, hearing, walking, or problem solving. Participation restrictions in normal daily activities such as working, engaging in social and recreational activities, and obtaining healthcare and preventative services. Right, blind describes condition in which a person has a loss of sight for ordinary life purposes. A person is legally blind when vision with best correction is no better than 2200. Low vision and vision loss are generic terms for vision loss caused by macular degeneration and other conditions. Low vision is usually someone who is legally blind but can still see really large print, bright colors, light and shadow, and large shapes, whereas vision loss refers to those who have lost vision after birth. All right. Visually impaired and visually challenged are considered negative terms. All right. Use terms such as person who is blind, person who has low vision, or person who is legally blind. Ask the client what term suits them best. In terms of brain injury or traumatic brain injury, clients TBI, this describes a condition where there is a long-term or temporary disruption in brain function resulting from injury to the brain. All right. Use person with a brain injury, or if you're working with someone, employee with a traumatic brain injury or TBI. All right. Do not say brain damaged. All right, cleft palate or lip describes a specific congenital disability involving the lip and the gum. You'll often see it split up here and sewn back together surgically. Say a person who has a cleft palate. The term hair lip is a no-no. That is anatomically incorrect and stigmatizing. All right. Congenital disability describes a disability that has existed since birth. All right. These are things like spina bifida that we talk about in our nervous system class, but not necessarily hereditary. All right. Use person with a congenital disability or disability since birth. Do not say no birth defect or deformity. All right. Deaf refers to a profound degree of hearing loss that prevents understanding speech through the ear. Hearing impaired or hearing loss are generic terms used by some people to indicate any degree of hearing loss. Hard of hearing refers to mild to moderate hearing loss. Saying person who is deaf or person who is hard of hearing. All right. Some people have a degree of both hearing and vision loss, prefer the term deaf blind. Also acceptable is person with combined vision and hearing loss or dual sensory loss. Do not use deaf and dumb or deaf and mute. All right, a developmental disability is a broad term that describes any physical or mental disability that starts before age 22. These include autism disorder, sensory impairments, cerebral palsy, etc., etc. People with a developmental disability do not have an intellectual disability. We are talking anatomical development, not mental ability. All right. So you can say she has cerebral palsy, he has autism, or they have a developmental disability. All right. We do not say they are mentally retarded. Disfigurement refers to physical changes caused by burns, trauma, disease, or congenital conditions. Please say burn survivor or child who has burns. Do not say burn victim. We are not victims, all right? We are survivors. Down syndrome describes a chromosomal disorder that causes a delay in physical, intellectual, and language development. As a side note, this is stereotyping and wrong, but I have never met someone with Down syndrome that also wasn't absolutely delightful. But you will always say person with Down syndrome. Right, HIV and AIDS is a disease of the immune system. We talk about this more in the immune class. Over time, HIV, human immunodeficiency virus, can weaken the immune system to a point where the body becomes susceptible to certain illnesses that healthy immune systems resist. People with HIV are diagnosed with AIDS, acquired immunodeficiency syndrome, when one or more specific conditions are met. Please be aware that there are a multitude of reasons for someone to be immunodeficient in your office, and this is one of the reasons it is so incredibly important that you are cleaning, disinfecting, wiping your doorknobs, not just your linens and your tables, but your countertops, your doorknobs, your toilet handles, your sink handles. Keep your office as pathogen free in between clients as absolutely possible. Now, when you have a client like this, use person living with HIV or people who have AIDS. I have had students ask me, can I really massage someone with AIDS? Absolutely. You can help increase killer T cell production. Absolutely. But you do not say AIDS victim. We don't call our clients victims, okay? Intellectual disability refers to limitations in intellectual functioning and adaptive behaviors that require environmental or personal supports for the individual to live independently. All right. Although mental retardation was previously an accepted clinical term, hopefully most of you are of the age that that is no longer true. But I know my age and the generations before me, it was very commonly stated just in open society. Quite rude. Many people consider that an insult. So people who have this condition, an intellectual disability, their families and related organizations have campaigned to end the use, okay? Say people with intellectual disabilities, all right? Do not use retarded, mentally retarded, or subnormal. All right, learning disability describes a neurologically based condition that may manifest as difficulty learning. All right, and using skills in reading called dyslexia, where you're swapping those letters around a little bit, writing, dysgraphia, mathematics, which is dyscalculia. Actually, I have a child with that, and other cognitive processes due to differences in how the brain processes information. All right, individuals with learning disabilities have average or above average intelligence, and the term does not include a learning problem that is primarily the result of another cause, such as intellectual disabilities or a lack of educational opportunity. We have instances of some famous geniuses or stealers of work like Edison and Einstein who had intellectual disabilities and were actually kicked out of school. Um, you need to say person with a learning disability. These are actually fairly common. If any of my students have a learning disability that you have been diagnosed with, make sure that you are contacting the school if you need to do so in case you need any accommodations with your NBLEX. If you have dyslexia, vision loss, things of that nature, we can get that NBLEX read for you if you have a disability on file. This is not something to be embarrassed about. This is something to make sure that we can absolutely support you so that you have all of your needs being met to be the best therapist that you can be. All right. Do not use slow learner. They are not slow. They just need something displayed a little bit differently. Okay. Do not say retarded. All right. Post polio syndrome is a condition that affects some people who have had poliomyelitis, polio, all right, long after recovery from the disease. It's characterized by new muscle weakness, joint and muscle pain, and fatigue. Say person with post polio syndrome. Again, do not use polio victim. We do not call our clients victims. All right, psychiatric disability refers to a variety of psychological conditions. Say person with psychiatric disability or mental illness. Although in some contexts, mental illness can be taken a little bit strongly by those suffering from it if they feel any sense of shame. I would just notate a psychiatric pathology, psychiatric disability. In a clinical context or for medical or legal accuracy, use the actual term of the illness itself, such as schizophrenic, psychotic, or other diagnostic terms. Bipolar disorder has replaced manic depression. All right, that has been replaced. There have been some additional changes this last year. So please make sure that you are notating the diagnoses that your client actually puts down in the intake. Words such as crazy, all right, is a no. Maniac, lunatic, schizo, psycho are all offensive and should never be applied to people with mental health conditions. All right. Seizure describes an involuntary muscle contraction, a brief impairment, or a loss of consciousness resulting from a neurologic condition such as epilepsy or from an acquired brain injury. Say person with epilepsy or teen with a seizure disorder. The word convulsion should be used only for seizures involving contractions of the entire body to be clinically correct. Do not call them an epileptic, saying that they're having a fit. Do not say that they are spastic or that they are having attacks. Service animal or service dog that has been individually trained to do work or perform tasks for people with disabilities. You can have anxiety animals, but do not use the term seeing eye dog anymore. To be honest with you, I had not heard this was offensive until I pulled this list from your book. But please use service animal or service dog if it's a dog or whatever type of animal it is. Do not say seeing eye dog. They may not be for someone who has had vision loss or blindness. Short stature describes a variety of genetic conditions causing people to grow less than 4 foot 10 inches tall. Say person of short stature, although some prefer little people. Dwarfism is an accepted medical term, but should not be used as general terminology because not everyone with short stature is technically afflicted by dwarfism. Do not refer to these individuals as midgets, please, because of the terms circus sideshow connotations. All right, speech disability is a condition in which a person has limited or impaired speech patterns. This can be a variety of things involving speech, but please state a child or person who has a speech disability. For a person without verbal speech capability, say person without speech. Do not say mute or dumb. Spinal cord injuries describe a condition in which there has been permanent damage to the spinal cord, resulting in some degree of paralysis. All right, quadriplegia denotes loss of function in all four extremities, so neither arm nor leg works. Paraplegia refers to loss of function in the lower part of the body only, so half of the body, the lower half, is not working. In both cases, the individual might have some function, mild function, in the affected limbs. Although people with spinal cord injuries often refer to themselves as a para or quad, communicators, massage therapists should always use person with paraplegia, person who is paralyzed, or person with a spinal cord injury. All right, do not say cripple. Do not say handicapped. Do not say confined to a wheelchair. Okay? We are not using these terms. Substance dependence refers to patterns of substance use that result in significant impairment in at least three life areas, like family, employment, and health, over any 12-month period. Although such terms as alcoholic and addict are medically acceptable, they may be derogatory to some individuals. Acceptable terms are people who are substance dependent or person who is alcohol dependent. Individuals who have a history of dependence on alcohol or drugs and are no longer using a substance may identify as recovering or as a person in recovery. Okay, this is another instance, just like cultural or gender questions. This is a case by case basis where you need to ask your individual client what they prefer to be referred to as or have it notated as. A lot of people feel associated shame with the behaviors that might have happened during this substance dependence. They may still actively be dependent on these substances. So please make sure that you are not inadvertently creating an offense by using a term that you think is normal, but they may feel a deep sense of shame with, okay? Again, our primary goal in massage isn't just touching the body and making them feel better. It is creating that safe space in our office environment for them, all right? Survivor is used by people to affirm their recovery from or conquest of an adverse health condition, such as a cancer survivor, a burn survivor, brain injury survivor, or stroke survivor. Do not call them victims. All right, everyone, we're going to talk about some additional terms covered underneath the ADA, the Americans with Disabilities Act. Now, I brought up accessibility earlier. Accessibility describes the degree to which an environment, service, or product allows access by as many people as possible, in particular with people with disabilities. I'll give you a personal example. My entrance to my massage front office and retail area is on a 4-foot high deck. So there are 4 foot of stairs that needs to be traversed in order to come in. That is not accessible by people needing a wheelchair or in some cases, if they have drop foot or another issue, lifting their leg fully, even though my stairs are more shallow than a standard set of stairs. So I needed to build a handicap ramp in the state of Michigan. For every 1 inch that you need to rise, there needs to be 1 foot of run, which means I need 1 foot of handicap ramp for every 1 inch that it needs to go. So 4 feet, that would have been a 48-foot handicap ramp. I needed to put some landings in there for turning capability. So I ended up building a 54-foot handicap ramp for my massage office here in Michigan. So just be aware that if you are going to open up your own place and are going to make it accessible, that you are following in full compliance with the Americans with Disabilities Act, all right? Another thing to pay attention to is assistive devices, also assistive technology, and that's any device designed, made, or adapted to help a person perform a particular task. All right, I know people with back issues have those little picker up grabber things, so you don't have to bend down as much. My mother has jar openers for her hand. People use canes, wheelchairs, all types of walking devices. And this could also be things even like insulin pumps, large print books, all right, that exceptionally large print, helping people with low vision. So please keep those things in mind. If you are able to make your office as accessible as possible and as friendly to their assistive devices as possible, that would be fantastic, professional, and complying with the law. All right, everyone. So, what is a barrier? A barrier is a factor in a person's environment that, through their absence or presence, limits functioning and creates disability. For example, in accessible physical environments, like if I had not put in that handicap ramp, a lack of appropriate assistive technology, someone who cannot walk well but doesn't have their cane, negative attitudes towards disability. A primary condition is a person's main health condition that may be associated with impairment and disability. A secondary condition, and these are important to note in your client intake and be aware of. A secondary condition is an additional health condition that arises from the increased susceptibility to a condition caused by the primary condition, although it may not occur in every individual with that primary condition. All right, a comorbid condition or a comorbidity. This is an additional health condition that is independent of and unrelated to the primary health condition. This is a secondary disease that you have that was not caused by the disability, but you now also have it. Disability is the umbrella term for impairments, activity limitations, and participation restrictions. Disability discrimination is any distinction, exclusion, or restriction on the basis of disability that has the purpose or effect of impairing or nullifying the recognition, enjoyment, or exercise on an equal basis with others of all human rights and fundamental freedoms, includes denial of reasonable accommodation. All right. Frail elderly is a term used for older people, usually over 85 years of age, who have a health condition that may interfere with the ability to independently perform activities of daily living. All right, not all people this age are frail elderly. They may be elderly, but they don't like that term either because that could indicate that they are frail. An example that I have is an elderly couple when I was living and practicing in Florida. The lady was around 94 years old with such bad rheumatoid arthritis, she was unable to use her hands at all anymore. Her husband and a nurse took care of her at all times. When she passed away, he started his own lawn mowing business and he came over and woke me up at 7 a.m. on a Saturday morning, excited because for his 98th birthday, he had treated himself to an eyelid surgery to remove the excess skin to be able to see the lawns better as he was cutting the grass. He was most excited about this new cosmetic surgery for himself that allowed him at 98 to mow even more lawns. So, again, not all elderly are frail elderly. Health is a state of well being achieved through the interaction of an individual's physical, mental, emotional, and social states. A health condition is another term for disease, either acute or chronic, disorder, injury, or trauma. All right. A health condition may also include other circumstances such as pregnancy, aging, stress, congenital anomaly, or genetic predisposition. An impairment is a loss or abnormality in body structure or physiological function, including mental functions, in which abnormality means significant variation from established statistical norms. An inclusive society is one that freely accommodates any person with a disability without restrictions or limitations. Right, everyone, an intellectual impairment is a state of arrested or incomplete development of the mind, which means that the person can have difficulties understanding, learning, and remembering new things, and in applying that learning to new situations. Also known as intellectual disabilities, learning disabilities, and learning difficulties, formerly known as mental retardation or a mental handicap. A mental health condition is a health condition characterized by alterations in thinking, mood, or behavior associated with distress or interference with personal functions, also known as mental illness, mental disorders, and psychosocial disability. All right, neurodiversity. This is the acceptance and inclusion of all people while embracing neurological differences. People experience and interact with the world around them in many different ways, and differences are not viewed as deficits. All right, so what is a reasonable accommodation? Reasonable accommodation is necessary and appropriate modifications and adjustments, not imposing a disproportionate or undue burden where needed in a particular case to ensure that persons with disabilities enjoy or exercise on an equal basis with others all human rights and fundamental freedoms. Rehabilitation is a set of measures that assist individuals who experience or are likely to experience disability to achieve and maintain optimal functioning and interaction with their environment. All right, a specific learning disability is an impairment in information processing resulting in difficulties in listening, reasoning, speaking, reading, writing, spelling, or doing mathematical calculations, for example, dyslexia. All right, universal design is the design of products, environments, programs, and services to be usable by all people to do the greatest extent possible without the need for adaptation or specialized design. All right, there's a couple of things to notate. We commonly are uncomfortable in situations that are new to us. We don't know what to do or say. So it is helpful to ask others to explain the unfamiliar situation to us, right? This could be some sort of cultural dress or custom, use of some sort of assistive device or adaptation needed because of size or mobility issues. If your client clearly is using a device, ask what is appropriate so that you can make accommodations in the massage therapy office. Now, since we're talking about terminology and writing things down, very often some of these diagnoses or names of the pathologies are incredibly long. Or if we want to notate what we are doing to the body, we might say right, but just use the letter R and circle it to indicate an abbreviation for the term right, or bilateral or unilateral. When we use abbreviations, all right, like when we say ADA for Americans with Disabilities Act, on any type of record, including charting, provide an abbreviation key either on the forms or in a conspicuous place in the file. This is especially important if you generate a specialized list of abbreviations for your office, like if you use SWM for Swedish massage, all right, or CTM for connective tissue method. All right, I never would have guessed CTM for connective tissue method, personally myself, so that is great to always have a key. And I do have a list of pathology abbreviations that's pretty awesome for you guys to be able to print out and keep and utilize. Abbreviations, however, should not be used excessively. An overabundance of abbreviations results in a passage that is difficult to read and that requires interpretation. If you are unsure whether an abbreviation is acceptable, write out the term completely to be able to communicate accurately. This is incredibly important in your SOAP notes, things that you might share with other healthcare providers or need to share either with the client or if you have been subpoenaed. Right, do not use jargon. Jargon consists of word forms specifically developed within a system, like when we say lay supine or prone, our clients may not know that we are saying, hey, lay on your back or lay on your front. An example would be the word mouse is computer jargon for a manual device that controls a cursor, even though the original term it was describing a small fuzzy mammal. All right. Many forms of jargon are used in the bodywork world, and that is a problem that continues to confuse communication. Now, we use these terms in massage therapy school and with each other as professionals, but your clients may not understand them. All right. Until your client knows what you are saying with those words, use clarity and concise expression because that is crucial when choosing the words used for written records, especially. Right, super important are terms related to diagnosis and diseases. All right, two terms that we use quite a bit are indication and contraindication. An indication is a condition for which an approach would be beneficial for a health enhancement. A contraindication is a condition or factor that may make an approach harmful. All right. When we are talking about contraindications, you are going to use the term general, systemic, or absolute contraindication for when you do not massage any part of the body, and you're going to use regional or local contraindication for when you can perform a massage, but you need to avoid a particular area. Application with caution and adaptation. This is usually requiring supervision from appropriate medical or supervising personnel. This is when you can perform massage, but carefully selecting the methods that are used. The duration may need to be altered. The frequency may need to be altered, as well as the intensity of massage for whatever particular pathology that your client has. And we are even protected in the state of Michigan with terminology, all right, according to the Public Health Code under Michigan law. So, the use of certain titles, words, or initials, you cannot use licensed massage therapist, masseur, massagist, certified massage therapist, clinical massage therapist, medical massage therapist, manual massage therapist, and it continues unless the individual is licensed under this article as a massage therapist. All right. So make sure that you complete your MBLEX, you pass, and you get licensed before advertising yourself after graduating school.